All throughout the year, but especially during the month of November, we talk about the importance of getting your lungs screened. Why? Because November is Lung Cancer Awareness Month, and one of the pioneers in that field is joining us here this morning. It is Dr. Rob Headrick. Dr. Headrick is the chief of thoracics at CHI Memorial. Dr. Headrick, good to see you as always.
Good morning.
Who's the good-looking lady you got here with you?
This was the brains of the family. It's my sister.
And the sister's name is Cathy Fiacco. Cathy, good to have you here with us.
Thank you. Nice to be here.
Tell me why you're along here with Dr. Headrick talking about the importance of lung cancer screening and awareness.
Well, the importance was heightened for me when I lost a classmate this year to lung cancer. And so we had my classmate from GPS. And so Rob takes this every year to a high school. This year we brought it to GPS so that we can not only honor her, but increase the education and awareness among the students and families.
I got to take part in this with Dr. Headrick for the past couple of years, and last year, I think it was at Baylor, I was blown away by the interest the students had and the technical equipment that you guys loaded in. You had a mini hospital set up at Baylor.
Well, you know, we do this for sports, recruiting talented athletes, so why not do it for lung cancer and engineers and scientists and kids that really want to go into a up-and-coming field with a lot of opportunities. So we're enticing them to not only learn about lung cancer and spread the awareness of screening, but hopefully encourage them to get into a career helping solve the lung cancer problem.
Here I am getting into the tube last year. It is quick, it is easy, it is painless, and even if you have a degree of claustrophobia, you don't feel like you're enclosed in anything.
One of the things we learned is that all of us, including myself, who feel normal, don't have a problem, will give you about the same time it takes to order a meal at McDonald's or Chick-fil-A.
Right.
So I had to make healthcare that quick, and that was part of what the Breathe Easy was.
And you were a pioneer in developing and making this go from an idea into a reality, and you see this all around town.
I was a troublemaker that said, doctor visits are too long. We got to fix this problem if we want people to engage in their health.
What about the immediacy of finding out the results?
So that's the other thing, is if once you complete the test, then waiting for that answer. There's a lot of, I call it PTSD, that's unnecessary. So our goal is to get the results as quick as we can, same day, through text messaging, HIPAA compliant, so people aren't sitting on the edge of their seats or worrying about it the whole day.
I know the first time I did it, and I admit it, I was pretty nervous from the time I went through it the first time until you called me.
Yeah.
And after you called me with the good news, I broke out in tears.
Yeah.
You have that happen with a lot of your patients.
That's why we call it the Breathe Easy. It truly does give relief, and most people are going to find they're okay. But they also find with that you're okay. Here's things you can work on. Here's things that will help you live longer, be a better mom or dad.
What's the elevator synopsis on exactly how important it is to get pre-screened and how beneficial it can be?
When we screen, we find lung cancer early. When we find it early, it's one of the easiest cancers to cure. Yet one of the deadliest cancers, it's also one of the easiest. It just has no symptoms, so we have to screen. We got to get people to engage in a quick test. That's frightening. But when you do, cure rates are over 90%.
And 10, 20 years ago, nowhere close to that.
That's 18%.
Think about that, all because of some of the pioneering work that your brother does.
Yes.
You got a reason to be proud of him.
I know, very proud.
You certainly do. Tell me about the significance of the lung cancer awareness ribbon you're holding.
So these white ribbons are crafted at the school, and so the students are a part of the crafting of the ribbon, painting of the ribbon. It gives an opportunity for us to talk to them about lung cancer. It also gives them an opportunity to reach out to the community, to people who they can sign the back with messages of support, and these ribbons go out to members of the community that have been affected or have lung cancer so that they can see that support. It also brings that awareness, because lung cancer in the past, I know when we were growing up, you didn't talk about it. It was a smoker's disease or something you didn't talk about. So this brings that awareness in the community and lets people reach out.
And that is not the case anymore.
No, you know, we're certainly, tobacco's not great. We're in a country that half of us have smoked. But we're finding that most cancers, particularly lung cancer, and even lung cancer in women, is more tied to genetics.
Who should get screened?
Anybody over the age 50 who has a family history of cancer, could be breast cancer, colon cancer, exposure to tobacco, or any other risk factors like radon and things like that. But we're going Anybody over 50.
When you're in doubt, just make sure and have it checked out.
Yes.
The first time you went through this, Cathy, were you apprehensive?
I was. It's any test, any medical test is apprehensive. And in fact, I was standing outside the bus and another woman was contemplating and she said, I'll do it if you do it. So we went in.
You get the white coat syndrome in a lot of
Yes,
cases.
even doctors and nurses get that.
Even doctors and nurses. All right, we're going to show off our socks here for just a moment. Can we get a close-up of these, Herman, if it's not too much trouble? Dr. Headrick was kind enough to bring me a pair or two of these recently, and just by happenstance. We didn't plan it like this. If we had, we never would have made it. But tell me the significance of these socks.
It's simply sock it to lung cancer. You have to have a prop to get people to talk about it. Socks are an easy way to ask, why are you wearing that? What is it? And it allows me to say, go get screened if you're over 50.
I know I've had a lot of people comment on those when I've been wearing them, and I always point them to you. Where can we get socks like this?
Alice Blue. You can call our office at the Lung Screening Center at 495-LUNG, and we'll get you connected with socks.
Get your appointment. Get your screening done. If you can't get it done in November, the Breathe Easy mobile lab is always out and about.
Always
it's
out.
technology coming to you. Cathy, very nice to meet you.
Nice to meet you too.
Dr. Headrick, good to see you as always.
Good seeing you.
Get your appointment, get screened, you will rest better, and yes, you will breathe easy. Check it out. Go to the Memorial website for more information. Stick around. We are back with more after this.